Good afternoon, everyone. My name is Craig Hammer with Prosperity Partners Wealth Management. I want to welcome everyone to our ongoing webinar series. It's an exciting time in our firm as this is our first webinar as Prosperity Partners Wealth Management. As most of you know, beginning July 1st, Swafford Financial and Tennessee Retirement Strategists combined forces to make Prosperity Partners, and we're excited about what the future holds for us. But today we have a series on understanding Medicare, and Kathy Morris with Senior Financial Group, a local company here in Knoxville, will be sharing information today about Medicare. Kathy teaches twice a month about this subject, and she is an expert on all things Medicare, and we're excited about having her with us today. But before I turn the program over to Kathy, just a couple of housekeeping items. If you have questions today as you're listening to the webinar, you can email those questions to info@prosperitypartnerswm.com. and we will try to answer those at the end of the webinar. Also, Kathy has kindly stated that she will be here about 30 minutes after the webinar to answer any questions, so feel free to call us at 865-690-0049, and we will be able to answer those questions again. So, Kathy, we're excited to have you with us, and we're ready to learn about Medicare.
Thank you, Craig, and thank you for inviting me here today. I appreciate the offer to have me come do this webinar for you. Sorry about that. Okay, so some things that we're going to cover today are who is Senior Financial Group and a little bit about myself, Catherine Morris. We're going to talk about your eligibility for Medicare, when and how to enroll in Medicare, the Medicare parts A, B, C, and D. Those can be very confusing sometimes. Also, the differences between Medicare Advantage and Medicare Supplement plans. And then we'll go over some ways that we here at Senior Financial Group can help you through this process. So Senior Financial Group was founded in 1983 by Gerald Johnson, who's a great boss with integrity who coaches his agents to do the right thing by our clients. We here at Senior Financial Group represent over 35 of the most reputable companies, which further allows our agents to cater to the needs of each client individually. We offer Medicare plans, dental, marketplace, and more. We like to educate and guide our clients for free. We want you to understand the process before making any life-changing decisions. Again, my name is Catherine Morris, and I am a licensed insurance agent. I do teach webinars Medicare seminars twice a month, and I do other teachings randomly when people would like me to come teach their groups about Medicare. I have had 12 years of insurance experience, starting with prescription drug benefit management, supplemental policies, and group health insurance. I'm Marketplace certified, otherwise known as ACA or Obamacare. All the insurances can be so different, so it's an interesting background in order to understand more about each individual person's needs with healthcare. My most favorite part about my job is that I specialize in helping people understand Medicare. It's quite a complex thing, and it can be overwhelming for most people. So let's get right into your eligibility for Medicare. So most of us know we have to be at least age 65, but we also have to be a U.S. citizen or a legal resident and have worked for at least 10 years in a Medicare-covered employment. If you're under age 65, you have to be deemed disabled by Social Security for at least 24 months. You also can qualify for Medicare if you have end-stage renal failure or ALS, otherwise known as Lou Gehrig's disease, at any age. So some important things about when and how to enroll in Medicare. You're automatically enrolled in Parts A and Part B if you're collecting Social Security. In order to sign up, you can go to www.ssa.gov or call 1-800-772-1213 or go to your local office. We can also help you with the online enrollment. When you turn 65, you have a 7-month window in order to sign up for Medicare. And that includes 3 months before you turn 65, the month of your birthday, and 3 months after your birthday month. You also can sign up when you retire if that's after age 65 and you're losing your credible coverage. Credible coverage usually means the same or better than original Medicare, but we can help you with that determination as well. If you or your spouse work and have health insurance, you may be able to delay Part B. There's no sense in paying for your Part B unless you really have to. There are similar timeframes for Part C and D, in addition to the annual enrollment period from October 15th through December 7th. If you don't enroll in a timely manner, there are enrollment restrictions and penalties that may apply. This list is not all-inclusive, so it's important to work with an expert. Now let's get into the actual parts of Medicare, which include A, B, C, and D. I'll describe each part first and a little bit about them and then move on to the next one. So Part A, that covers your hospital insurance. Things like inpatient hospital, home health care, skilled nursing, and hospice. Part A does have what's called an inpatient hospital deductible per benefit period. A benefit period is a period of time when you're home and out of the hospital or skilled nursing facility for 60 consecutive days without receiving care. So when you're admitted to the hospital and considered inpatient, you will have a deductible that's $1,316 for the year of 2017. These amounts do go up every year. After you pay your inpatient hospital deductible, you will have a daily coinsurance for days 61 through 90. So anything up to the first 60 days, you'll just have the one deductible of $1,316, but then anything after 60 days through 90 days, you'll pay $329 per day. The next thing you have to worry about with Part A costs is there is what's called a coinsurance for lifetime reserve days. Of anything over 90 days in the hospital, you would pay $658 per day with only a lifetime reserve bucket of days of 60 days per lifetime. One other item is the coinsurance if you get put into a skilled nursing facility. Now, I'm not talking about just a nursing home, which is what we think of as, you know, an old folks home or whatnot. It's more like, say you fall and break your back or your leg and you have to be rehabilitated after you're out of the hospital because you can't go straight home and function in your house. So if you're in a skilled nursing facility to rehabilitate for, you know, a broken item like your back or leg or something, the coinsurance is $164.50 every day over 20 days. So these are just some of the gaps in Medicare Part A that you should be aware of. Also, keep in mind that in order to enroll for Medicare Part A, there is no cost as long as you have worked at least 10 years in your lifetime, or you have a spouse that you've been married to for at least 10 years, and you can claim Medicare under them. So now let's talk about Medicare Part B and what that covers. Medicare Part B covers things like your doctor's visits, any diagnostic tests you might need, like say an MRI or a CAT scan. Also some preventative services. Your colonoscopies usually come under this, and among other things, your preventative wellness checks, etc. It does cover your ambulance and emergency room visits. Keep in mind that when you go to the emergency room, if you're not considered inpatient, then you will not pay that Part A inpatient deductible until you are actually admitted. Also, Part B covers things like durable medical equipment, things like walkers, wheelchairs, things like that. It will also cover physical therapy, mental health services, both inpatient and out, as well as medical supplies. Some medical supplies, for example, are like if you're a diabetic and you need your test strips and machine and that kind of thing. So Medicare Part B, as most of you know, does come with a Part B premium that you have to pay once a month. If you're taking Social Security, it can come right out of your Social Security benefit check. And right now for the year of 2017, that amount is $134 per month. Of course, this is based on your income. So if you are single and you file taxes in 2015 and you're retiring in 2017 or turning 65, you're going to pay usually about $134 per month. You do have a yearly deductible associated with Medicare Part B, and that would be $183 per year. The other cost associated with Medicare Part B is a 20% coinsurance that you're responsible for. Now keep in mind that these are all gaps in original Medicare that we're talking about, so that you understand when we go on and talk a little bit more about Medicare supplements and Advantage plans. Finally, well, let's talk about Part C. Part C is actually considered Advantage plans. What that does is combine your Part A and Part B together, usually along with Part D, into what's called Part C, which is an Advantage plan. I know that it can be confusing. Lots of parts to remember. So let's talk a little bit about Medicare Part D, and then we're going to go back and talk more about the supplements and Advantage plans to a better extent. So Medicare Part D, that is your prescription drug coverage. And when you pick an Advantage plan, your drug coverage is going to be included in that. And so whatever it is, depending on what plan you take, is what it is. If you take a supplement plan, though, you've got a lot more choices as far as what plan you'd like to have according to where you shop, what pharmacy you go to, as well as what medications you take. So those are some important one-on-one things that you need to discuss with an agent in order to fit a plan for you and what your needs are. So Medicare Part D starts out, generally most plans have what's called a deductible stage. A lot of plans have a deductible of like $400. Now there are less deductibles out there. In fact, you can get some that are a zero deductible. So that's another point to consider when you pick a plan for yourself. Do you want to pay more for your premium for the prescription Part D every month? Or do you want to pay a little bit less and then have a bigger deductible stage? Also, things like what kind of medications you prefer to take. Do you prefer generics or do you prefer the brands? That will also affect your cost. After we go through the deductible stage, we have what's called initial coverage stage. So obviously, if you pick a plan without a deductible, you'll go right into your initial coverage stage. That's where your prescriptions are going to cost, anywhere from, zero copay a month to, $5 and $10. Sometimes they can be more. It just depends on the plan, and there are a lot of plans out there to choose from. So once you go through the initial coverage stage, you're going to go into what's called the coverage gap stage. This means when you have paid, in combination with the drug plan and the pharmacy discounts, a total of $3,300. But in actuality, as the patient, you're going to pay about $825 before you reach this coverage gap stage. Now, I know this sounds confusing, but if you'd like to sit down with me and talk about this, how it works for you, it would make more sense with the medications you're on for me to describe it better to you so that you can understand that. Now, once you hit the coverage gap stage, you're going to be paying about 40% for your brand name medications and 51% of the generics. Once you've reached what's called your out-of-pocket expenses of $4,950, you'll enter what's called the catastrophic coverage stage. This is where your prescriptions actually come down in price considerably. And then you pay like 5% of what the prescription medication would cost. Keep in mind that all plans have tiers and formularies, and they have coverage rules. All plans are based on a calendar year, which is January through December. I know all these parts can be confusing, so hopefully going into the Medicare Supplement and Advantage portion of this will help you understand those parts a little bit better. So Medicare Supplements versus Medicare Advantage. Now, I've had people ask me, oh, you do Medicare, so what do you think is better, supplements or Advantage plans? Well, I can't answer that question for everyone as a whole because everyone is different. What makes you sleep better at night may not make me sleep better at night, and vice versa. So we just have a lot of things to consider, and that's another reason why it's very important for you to sit down with someone you trust to help you with this decision. So let's talk about why we should choose one over the other and some important things to consider when choosing a supplement versus an Advantage plan. So let's kind of go back to the basics of our Part A, which was the hospital insurance coverage, and Part B, which is the medical insurance coverage. So if you want to keep original Medicare, which is your basis for a Medicare supplement plan, you'll then decide what prescription drug coverage you want to take. And then if you actually feel like you need to add a supplemental coverage. These are sometimes called Medigaps, which is the same thing as a Medicare supplement. And just think about it as a Medigap plan is covering the gaps of Medicare, or a supplement plan is to supplement original Medicare. And again, original Medicare are some of the items that we were talking about a little bit ago, where we have the inpatient hospital deductible, we have our co-pays and co-insurances and whatnot. So if you want to keep original Medicare, it gives you some flexibility about where to go and who you can see. And then you add the Medicare supplement insurance policy, and that covers those gaps. So let's talk a little bit about the Medicare Advantage plan, and then we'll go back and compare and contrast the two so that you can understand what your options are just a little bit better. Now, Medicare Advantage plans, they usually combine your Part A, B, and usually Part D. So again, Part A is your hospital insurance, and Part B is your medical insurance. So if you pick an Advantage plan, they're considered HMOs or PPOs. HMO stands for Health Maintenance Organization, and PPO stands for Preferred Provider Organization. They usually give a little bit more flexibility in who you can see than a health maintenance organization. But both of these plans give you a lot of rules and restrictions about where you can go, who you can see, and what you can have done. So although there is an advantage to having an Advantage plan as far as it does combine a lot of things together, the health insurance company is the one who decides what you can do. And again, this will combine with your prescription Part D drug coverage. What we have with our prescription drug coverage is exactly what's given to you with the Medicare Advantage plan. So there isn't much leeway on what plan you can choose as far as that goes once you've chosen your Advantage plan. If you choose a Medicare Advantage plan, you will have what's called restrictive networks of doctors and hospitals. You'll have co-payments to your providers. The company you choose will control which tests and procedures are allowed for you, and you will not be able to appeal your coverage decisions to Medicare. Plans differ from one company to the next, but your plan can change every year. Your plan can also be canceled, and they can drop your doctor. You will usually need to see a specialist, you will usually need a referral to see a specialist with an Advantage plan as well. And there's usually a monthly premium tied to your Advantage plan. Some things to consider are also you will have to be in a certain county in order to be on certain Advantage plans. You do have enrollment periods in order to sign up for your Advantage plan, which does include when you originally sign up for Medicare, as well as once a year we have what's called annual enrollment period between October 15th and December 7th. And again, the Advantage plans do cover your prescription drugs. Now, some of the advantages of having a Medicare supplement plan is you do not have a restrictive network of doctors and hospitals. So you can choose what doctor and hospital you want to go to and not worry about whether they take your plan or not. You do not have co-payments to your providers. You don't have to worry about the health insurance company telling you whether you can have that MRI your doctor wants you to have or not, or other procedures. And you can appeal your coverage decisions to Medicare. Plans do not differ from one company to the next with a Medicare supplement plan. So depending on what plan you choose, which there are a variety of choices with Medicare supplement plans as well, but we won't get into that today because it's too many to talk about. But definitely if you want to know more about it, you can feel free to ask me about that. Now, when you choose which Medicare supplement plan you want to take, it's not going to matter what company you go with. So if you have a company you prefer to use or one you prefer not to use, we can work around that with you. And also, if you get one with the lowest cost going right now, it's going to be the exact same policy as if you went with the highest cost. So that's a good thing about that because Medicare regulates Medicare supplement plans. You cannot change, your plan cannot change each year for you as well when you're on a Medicare supplement. They won't cancel you as long as you pay your premiums, and they will not drop your doctor. You do not need a referral to see a specialist, and you can see any doctor or specialist in the country, assuming they accept Medicare, which most doctors do. One very important thing to consider when you're picking a Medicare supplement or a Medicare Advantage plan is this. If you were to be diagnosed with something pretty complex, like let's say cancer, for example, and you're on an Advantage plan, you would only be able to go see a local cancer doctor or heart specialist, let's say. But if you're on a Medicare supplement plan, you can go anywhere in the world to be treated. Say you're diagnosed with a rare form of cancer and you'd like to go to MD Anderson in Texas. Well, you would be able to with your Medicare supplement plan, and they would pay for it all. Your Advantage plan would not allow you to go there, nor would they allow you to go to a Mayo Clinic or, say, Cleveland Clinic in Ohio. There are monthly premiums associated with your Medicare supplement plan, but trust me when I say when they may cost a little more than the Advantage plan, when you look at all the differences between what you're going to pay on an Advantage plan versus a supplement plan, it usually more than equals out at the end of the year. So these are all important things to consider when you're choosing an Advantage versus a supplement plan. And once again, it's very important to work with an expert who can help you through this process according to what your needs are, not what the agent's needs are. Now, when you do pick a Medicare supplement plan, if you're not in what's considered the initial enrollment period, which is the period of time when you first enroll in Medicare or you retire, you will have to answer health questions. So I usually do urge people who have already been diagnosed with something critical to take a supplement plan when they can. There are no county residency requirements or enrollment periods for your supplement plans. But one thing to consider is your prescription drug coverage is not right in with the supplement plan. That may seem like a disadvantage on one hand, but on the other hand, it's a big advantage because we can find a drug plan that works best for your needs according to what medications you're on. So again, in picking a supplement versus a Medicare Advantage, you do want to consider who you can trust to help you through this process. You also want to consider where you want to get your care now and in the future. Maybe you're healthy now, but we never know what will happen as we get older. What medications do you take? Are you willing to reevaluate this every year? Or maybe not. You don't have to, but you could. You might save money every year if you give me a call and say, hey, Kathy, will you look at my prescription drug coverage this year and see if the formularies have changed? They get as competitive as your local gas stations anymore. So we can definitely look at that for you. Also, you want to consider what your total medical costs will be, including premiums, copays, etc. And do you travel much? That's a very important decision when you take an Advantage plan versus a supplement, because if you're, say, down in Florida on an Advantage plan and, I don't know, you get stung by a jellyfish and you're admitted to the hospital and, I don't know, maybe you have a severe allergic reaction to it. Well, they're going to try to slap a Band-Aid on that and send you back to Knoxville or wherever you took your Advantage plan from, because they know they're not going to get paid as much on that Advantage plan. Now, if you have a supplement plan, they will take really good care of you. And I'm not saying that they wouldn't take good care of you on the Advantage plan, but they'll try to get you just well enough to get you back home. So with all these things to consider, it's definitely important to find somebody who can help you with these decisions that you can trust. So how can we help you here at Senior Financial Group? Well, amongst all the things that we've already talked about, we can also help you with your questions for your HR and benefits administrators. Because something I've not talked much about but is very important is a lot of you retire with benefit plans from your company. So what does that mean for you now? Well, we can go over that as well. We can also help you ask your HR department the specific questions and make sure that you get the right answers that benefit you most so that you can determine what you need to add or not add to that coverage. Also, we can help you with determining if you have credible coverage. And that means also in your retirement plan, because it is very important that you make sure that you do have credible coverage with your company, even if you're not retired yet, but you are 65. Because if you don't have credible coverage, then you'll face penalties. And if your company is giving credible coverage, they'll be registered with the Centers for Medicare Services, so it will be legitimate at that point. Now, we also will help you here at Senior Financial Group with an analysis of your coverage continuation, comparison, and coordination. That also includes if you've got a spouse who's still working and you're retired, you, again, do not need to take your Medicare Part B out and pay for it if you've got credible coverage with your spouse who is still working. So these are just a few things that you need to consider when picking out a Medicare plan that works best for you. So I guess that about sums up our time. And I want to thank you for taking the time to listen to me today. Hopefully I didn't bore you to tears or confuse you more. But feel free, if you do have some questions, to call. I will be here for 30 minutes after the webinar. You can call at 865-690-0049 if you have any questions you'd like to ask me, or you can email us at info@prosperitypartnerswm.com if you'd like to ask later. Please visit us online at www.sfgmedicare.com or like us on Facebook at www.facebook.com/SFGMedicare. We also have a Twitter account if you'd like to follow us there, and that is twitter.com/SFGMedicare. We also have a YouTube channel that if you'd like to keep up to date with us, you can subscribe to that. And tell your friends and family all about us. We'll be happy to help you with any of your questions to do with